Alright, hello everybody. My name is Jamal J and welcome to my YouTube channel, which is a phrase I honestly thought I would have never said. I never thought I would say that phrase in my life. But today we're going to keep it short, we're going to keep it sweet, and we're going to keep it simple. Because today we are going to be talking about Emgality. And what is Emgality? So let me just give you a brief background. I've been dealing with migraines for the last decade now. And recently, within the last couple of years, I started getting cluster headaches. Now, if you know anything about migraines and you know anything about cluster headaches, they share similar pathophysiology. And one thing that is common between both of them is this peptide known as CGRP, calcitonin gene-related peptide. It turns out that this thing is released by the trigeminal nerve, and whenever it's released from the trigeminal nerve, it binds to the vascular structures inside the meninges, so those arteries. That is really the simplest explanation I could give you for what migraines and cluster headaches pathophysiology is. So if you block this thing called CGRP, then it doesn't bind to those receptors on the blood vessels, you don't get a migraine. So somebody much smarter than me came up with the idea to make a monoclonal antibody that when you inject it into yourself subcutaneously, it goes and it basically holds on to those CGRP molecules, proteins, and it says, chill out, little boy. And basically just knocks them out. So in theory, you shouldn't have any migraines, you shouldn't have any cluster headaches, or at least it should reduce the frequency of migraines and cluster headaches. So we're gonna give this thing a try. This is Emgality, again, 100 milligrams per milliliter, prescribed to me by one of the best doctors in the whole country, one of the best neurologists in the whole country. I'm not going to call his name or their name for confidentiality purposes, but best doctor ever. So here's the thing, I'll just give you a brief description on how to use Emgality. Some things that we need to be aware of is the fact that we need a sterile field. This is a syringe and you have to inject it yourself. So nurses, phlebotomists, all those people, those are experts when it comes to needles. Me, I'm not an expert. So I'm being really cautious when it comes to using something like this. So the instructions, which Emgality comes with, tells you to wash your hands. Make sure that you use soap and water to wash them. Currently living in the COVID era, so they were washed anyway, but I just went ahead and washed them again, making sure 20 seconds, making sure all those bacteria and all the pathogens are out the way. And then also what we'll do is we'll use this sterile napkin. So it's not alcohol. Emgality recommends alcohol, but this is benzalkonium chloride. So if I get sepsis and go into septic shock and die in the next couple of days, it's not Emgality's fault. It's because I didn't use an alcohol pad. So we'll take the syringe. There's 3 of them. We'll take one and we'll inject it. Put it at a 45-degree angle. All right. We'll inject it into the sterile field at a 45-degree angle, and then we'll press that syringe, pumping Emgality into my system. Then he'll go and he'll look for CGRP and he'll say whoop 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 whoop. Oh yes, and then after that we will leave the needle in, not the needle, leave the syringe in, remove the needle from my skin or subcutaneous fat, because that's what it is. It's subcutaneous tissue. You inject it into the subcutaneous tissues, which is more of the fatty regions of your body, so behind your arm, on your thigh, your buttocks, as Emgality call it. Very classy people. And then also your thigh. So I chose the thigh because that's just easier for me to do. Or you could have done it in your abdomen as well. So anywhere you have a lot of fat. Actually, not anywhere you have a lot of fat, just the areas that Emgality said to use it, because I'm not telling people what to do here. I'm just telling you what Emgality told me to do. So yeah, we'll inject that, and then we will use a container. I don't have a dedicated Sharps container at home. I don't know how many people are carrying them around. except people who might have to take a lot of injections, maybe diabetics, for insulin. Let's see who else. Nah, that's going off on a tangent. But I'll put it in a container, a hard plastic container with a lid, and then we'll seal it, and then we'll dispose of that the proper way. I don't want this video to come out in 20 years when I'm working in healthcare and someone said, oh, Jamal didn't dispose of a sharps container properly. Let's, cancel him and take away his job. That's not gonna happen to me. So I'm telling you straight up, I'm doing everything the right way today. So the next video is probably gonna be me injecting this Emgality into my system, and then I'll probably do a little animation of Emgality fighting off CGRP and getting some relief from these migraines. And then I'll keep you updated afterwards to let you know how it goes. It's a 1 time per month injection, so only once every 4 weeks, and then we'll take it from there. And I'll keep you updated because I feel like a lot of people are silently struggling with migraines, and I want you to know that might be something that you don't have to struggle with. So Emgality is currently clinically recommended for migraine sufferers and cluster headache sufferers. Thing about monoclonal antibodies though, they do cost a lot of money, especially if you're uninsured. And that's a subject for another day. But as technology gets better and accessibility gets better, hopefully the prices of this thing come down, because nobody should be suffering from these things and losing quality of life, because that's exactly what it is. You lose quality of life when you suffer daily from these things. They keep you off your feet for hours. You lose productivity. I'm currently in graduate school right now, trying to stay on top of work. I can't even do that. Not because of making YouTube videos, but just because I have these migraines all the time. So let's see what Emgality has to offer. And thank you again for watching the video, man. I've been talking for too long, so cut. Okay, let's come up with a game plan. Now, as I told you, I'm a pretty skinny person. I don't really have a lot of, subcutaneous fat. So this is the game plan. I'll pinch an area like that. The instruction says to come in at a 45-degree angle. Boom, boom. And then inject it and dispose of it. You see here I have my hard plastic container labeled sharps. That goes to you, all future residency programs watching these videos, wondering if I should be admitted into their residency program. Yes, I am responsible, and I'm also adaptable. You see, I didn't have a sharps container, I created one. So please let me into your programs. Don't cancel me. All right, so next video is gonna be me just sterilizing and actually doing the injection. And I won't talk as much. Not because I'm scared or anything. All right. Sterilize. All right, here's to a better future. 45-degree angle. That wasn't too bad. That wasn't too bad at all. All right, so I will just continue to update you all on um, the process and how it's going, and keep you updated on the migraine journey. For now, the injection, I'm not gonna lie, it did hurt a little bit. That was the worst injection I ever had in my life. The needle didn't hurt. The needle was fine. The needle was absolutely fine. Like I didn't feel the needle going at all. It was when I started putting the Emgality in is when it hurt. But it is, you know, that I would take 2 more of those over another migraine for the rest of my life. I would easily do that if it meant I would never have another migraine for the rest of my life. That's an easy compromise. So I usually see nurses like rub the area that they put the injection in. You know, I think that helps it distribute a little bit better. There was a little bump there after I finished the injection because, I don't know, maybe I did it the wrong way, but we'll see. We'll find out. It's in my body now. Regardless, it's in my body. So we'll see how that goes, and I'll keep you updated. Thank you all so much for watching this video. This is disgusting. I shouldn't have showed you that. I should have disposed it, but I didn't. So if there's anything I could get canceled for, it's probably this. But thank you for watching the video, and I will keep you updated on the Emgality journey. I don't think it really has, you know, well-studied adverse effects, especially because the drug is new. It was, I think it had FDA approval, and let me not talk about something that I don't know. But 2019 is a year that sounds familiar. I don't know what happened in 2019, but the drug is pretty new. So, just some tenderness at the site of injection, or rash at the site of injection, I think is a common side effect, but it's different for everybody. So we'll see how it affects me, and hopefully it's the start of new and less painful future. So thank you for watching this video, and I'll be seeing you all soon. Bye. 30 minutes after, still alive. So I'm going to go end the video there, but thank you so much for watching the video, and have a good day.